Okay, so for my last pathology and my final film critique, since we were pulled out of clinic and everything, I wasn't able to get a last path. I couldn't find one. I was like scurrying around for one the past couple weeks. So I just found one online, and this is Cardiomegaly. Image modality is CR. Projections are PA and lateral. Here's the PA, and then the lateral is here. And then image receptor info, like I said, the modality is CR. It's 14/17, crosswise for the PA, and then lengthwise for the lateral. And then there's a grid inside the bucky. Technique for CR. So for my PA, for an average patient, if it's CR, I usually use 125 at 4. I bump up the kV about 3 to 5 to use a lower mass, and even patients that are above average, it's been working for me to use a lower mass and a higher kV. And then for the lateral, I would use 125 at about 12 to 16, just depending on the patient's size, with a 72-inch SID. And then for exposure factors, you can tell there's adequate brightness and density. You can see the lung markings, the hilar markings. You can see the apices well, both of the claustrophrenic angles. You can obviously, there's an enlarged heart there. You can see plenty of air here. You can even see the thoracic vertebrae. So I would say that this has good, adequate brightness and density, and it would be diagnostic quality, of course. Positioning, as you can see, the positioning is good here. The clavicles go down into the apices, and the apices are symmetrical. And then here you could see the ribs are almost perfectly superimposed, as well as the claustrophrenic angles here. So this is really great positioning. The arms and humerus and stuff is out of the way, so you can see that there. And for positioning as well, you obviously want it to be upright to make sure you can check for air fluid levels. Central ray is at T7, a little bit of light above the shoulders. And that's that for that. And then shield for about patients that are about 65 and younger. Depending on the site, you can still shield after that. And then for anatomy identification, you can see the thoracic vertebrae there, the ribs, you can see the claustrophrenic angles here, the hemidiaphragm. For the PA, you can see the sternoclavicular joints. You can see the heart is very enlarged. And the first rib, second, third, fourth, fifth, all the ribs there. That's that for anatomy identification. And then for the pathology, etiology and predisposition conditions include congestive heart failure, hypertension, aortic stenosis, and mitral regurgitation. Some stats on cardiomegaly were kind of hard to find exact stats because everything kind of went with heart disease. But heart failure from cardiomegaly increases with age and is more common in males than females. Symptoms include abnormal heart rhythms, chest pain, dizziness, extreme tiredness, bloating, and swelling of ankles, feet, and the legs. Method of diagnosis includes a blood test, a stress test, and of course an x-ray can also diagnose this. Treatment, cardiomegaly can heal on its own, or something by simple as lifestyle changes, no smoking, no drinking, watching what you eat and stuff like that, watching your weight. If that doesn't work, medications can be given, as well as a heart device can be implemented if it's really that bad, to regulate the abnormal rhythms. And then surgery would be obviously the last option if those didn't work. And this concludes my last pathology. Forgot to add my references. I used Radiopedia, CDC.gov, and Bontrager.